Hello everyone. On behalf of Health Parliament, I, Tejasvi, would love to welcome one and all on the occasion of International Nurses Day. Today, we also celebrate the birthday of Florence Nightingale, also known as the Lady with a Lamp, who has contributed immensely within the nursing domain. Nurses, who are they exactly, and why are we celebrating this day on a global level? Well, in order to understand the importance of this day, it's very important to understand the critical roles and responsibility they execute. Nurses are those individuals whom we all can find in hospital, clinical setup, etc., running back and forth for the well-being of other individuals. They are the central to primary health care and are often the first and sometimes the only health professional that people seek for initial assessment, care, and treatment. They play a critical role in health promotion and disease prevention. They provide care in emergency settings, and it has been said that they will be the most vital resources for the achievement of universal health coverage. So today, on the occasion of International Nurses Day, Health Parliament has invited a very pioneer guest who has immense experience in the field of nursing and has contributed tremendously within this domain. We have Ms Abanti ma'am along with us, a professionally qualified clinical nurse and has a career spanning over 4 decades. Her experience includes clinical practice, administration, teaching, and research guidance. She has initiated postgraduate diploma courses in cardiovascular thoracic nursing and emergency nursing approved by the Indian Nursing Council. The first Master of Nursing program in West Bengal was started by her at the B.M. Birla Heart Research Center. Later, the first master's program in oncology specialty was also initiated at Tata Medical Center, Kolkata, under her guidance. She has also worked with WHO on various projects. Currently, she is involved in conducting assessments for various hospitals in the country in the capacity of principal assessor representing the National Accreditation Board for Hospitals. She has served as a member of the technical and various other committees. We are very glad, ma'am, to have you on this crucial day and would love to have your insights about nursing industry and professionals from your rich and vivid experience.
Thank you so much. Thank you.
Thank you, ma'am. So before going ahead with my question, I would love to ask about your journey. What were your challenges, key moments, and learning within this journey?
Okay. So first of all, thank you for having me on Health Parliament program. And I would like to also take this opportunity to wish all the nurses across the globe the very best for our Nurses Day today. My journey is over 47 years from the day I entered the nursing college till date. And I have nothing to regret. I would love to say and reach out to all the youngsters that I have never ever thought back or regretted making a choice option for nursing as a profession. And I like to reiterate that I had chosen nursing as a first choice for my profession. Yes, I would like to say that the journey I have gone through has had its ups and downs. There were problems one has to face, but one has to first of all be very knowledgeable, self-confident, and if you are able to persevere and pursue your goals, even those who are in opposition, they will finally comply, they will understand. You have to be having the ability to convince others the reason why you want to make changes or the reason why you want to introduce some kind of a pattern into the nursing system. So that is there. And of course, there were oppositions usually come from the medical fraternity, unfortunately, but there are many who are extremely foresightful and they encourage nursing to come up in their profession. So there are two sides of the coin. And administrative wise also there have been oppositions, but I have always felt that with all there nothing can be done in life without opposition, and the more opposition we face, the stronger we get. So we should not give up. We have to be persevering, and every battle cannot be won. That doesn't mean that we give up. We should keep trying. If we can convince people that it's for the better care and safety of our patients, then people will understand.
Thank you so much for sharing your experience. Going forward with the next question, how is nursing playing a crucial role in the entire healthcare ecosystem according to you?
Since nurses are in the forefront, as you mentioned in your introduction, that they are the ones 24 by 7 at the bedside, and in even at times of any kind of critical emergencies and crisis, they are the ones who will be able to identify. And unless they are able to identify that there is a crisis going to happen or happening, they will not be able to alert the other team members. So it's very important that they are empowered to make clinical decisions at the bedside. They are empowered with opportunities to enhance their knowledge and skills and update themselves. These facilities should be supporting them to develop clinical domain experts, which nurses are. These are some of the things. This is the reason why nurses play a crucial role, because it's the nurses who will be initiating any kind of action or treatment for the patient.
Okay, ma'am, completely agree. Okay, going forward, according to the recent surveys and reports, it has been noted that nurses are facing burnouts, are willing to quit jobs. So, what do you think are the major reasons for it, and any suggestions for the same?
One of the major reasons is there are various reasons. One of the major reasons in the last 3 years have been the effect of the pandemic. Because I mean, we all know the toll that has taken on the nurses being, wearing the PPE 24 hours and being inside closed up areas. It was not easy. And many nurses themselves, many nurses themselves became victims of COVID, and many lost their lives also, unfortunately. But one of the reasons which added during the pandemic was the work schedules. As we know that there is a global shortage of nurses. So to overcome the shortage, most of the time in many of the hospitals, nurses have to repeat a shift. So usually the accepted norms for a nurse to work is 8 hours during the day, or a 12-hour shift during the night with adequate breaks after the night. But many hospitals are not able to provide this kind of compensation. And when they make the nurses work overtime, they may compensate with other means, but not breaks. So that ultimately has a mental and emotional turmoil on the nurse. So that is one of the reasons that they want to quit. Second thing is there are various lucrative jobs available, glamorous careers available, which were not there, maybe 2 or 3 decades before. So, like for us, we came into nursing and we never thought of diverting anywhere else. But today, yes, there are many other lucrative opportunities. So nurses do want to move away from nursing. Nursing is a profession which is not glamorous. It's a lot of hard work. It's a lot of mental and physical stamina, both, which is not easy. Not everyone comes in prepared to take that. And another reason why they quit is when they join nursing, they are not mentally prepared what to expect. They come with different kind of expectations. They look at the future goal that they will have a lucrative job and they will travel overseas. But in order to reach that level, there are a lot of years, minimum 4 years of grinding hard work, which they have to go through. Many are not prepared for that. So that is another reason they quit nursing.
Okay.
And
Now,
of course,
yeah.
there are other reasons, like I mean, family obligations and things like that. Many take a break and then they come back later, once their families are settled down. So that is also there. So my suggestion would be that those of you come into nursing, please first do homework, find out. Career opportunities should be sought. You must be aware what you're getting into. And secondly, once you are into it, learn to love the profession. It's just like mother gets a baby not by choice, the baby that comes. So you learn to love. We get our parents or brothers and sisters not by choice, but we love them. Same way, if you have come into the nursing profession, learn to love it. And only when you love it, you will be able to sustain.
I agree, ma'am. Okay, going forward with the next question. I think you must be aware of this, that 2022 theme for International Nurse Day is Nurses, a Voice to Lead, Invest in Nursing and Respect
Yes.
Rights to Secure Global Health. How far do you think it is essential that the government invests in the nursing domain? And which are the areas you feel require more investment for the growth and development of nursing professionals and industry?
Okay, so of the recent past, government has done a lot in investing into nurses. Especially, I mean, I am based in West Bengal, and I can say that in West Bengal, all over the country, I think government hospitals have increased the number of nursing positions. So that's a big investment where you try to meet the ideal ratios set by Indian Nursing Council, which is for critical care areas 1:1 and 1:2, and in the non-critical care areas, according to the acuity of the patient or the degree of illness of the patient, it will be 1:5, 6, or 8. So in order to meet these ratios, the government has tried to take, even recently in West Bengal, 4,500 nurses were recruited. But this again has backfired on the private sector. The corporate hospitals and the private sector lose chunks of nurses in large numbers, and they face the brunt of it. But nevertheless, unfortunately, we have two Indias. So we have to look whether we have to serve the masses or the classes, and we need to take care of both sectors. So government has started doing that. A lot of in-service education and training has developed in the recent past in the government hospitals. So upscaling nurses, giving them up-to-date information, conducting, having credits for attending workshops and things like that, because now registration has to be renewed. It is not like before that automatically once you're registered, it's for lifetime. Every 5 years, nurses have to renew their registration. And in order to renew, they have to fulfill certain credit hours. So for that reason, government has started a lot of these kinds of workshops and training programs for the nurses in service education. Apart from that, deputing nurses for higher education has also increased. A large number of government hospitals in West Bengal have come up with a master's program as well as PhD programs. So that's a huge investment. And the number of colleges of nursing in West Bengal itself, I was checking, we have 17 nursing colleges over the past decade, which is a huge investment. And most of the colleges have also started the master's program. And PhD program across the country is a huge number nowadays. And it's very heartening to see that doctorates in nursing are not only moving into academics, they also are in the clinical areas. And a lot of, as well as corporate hospitals, are led by doctorate nurses, which is a very positive sign. So this is some of, and also government has invested in creating positions for nurses like nurse practitioners. But unfortunately, the nurse practitioners, Indian Nursing Council has started nurse practitioner courses. But unfortunately, these nurse practitioners are not able to establish themselves as a true nurse practitioner. So they are working in hospitals under different roles, but that is not true nurse practitioner. That is one area government has to invest and give them the liberty to work as nurse practitioner, especially in the rural health areas, community health sectors. The nurse can actually run the centers where we have so much of doctors are not available. So if they are given this kind of a entitlement, this kind of a liberty to run a small clinic in the rural areas, I'm sure nurses will be very happy to do it, because nurse practitioners are there, but they are not functioning in the true capacity. That is an area government and the private sectors have to sit up and work on.
Sure, ma'am. Thank you so much for sharing. Okay, we'll go to the next question. How important is the term empowerment within nursing industry? How essential is to work on structural and psychological empowerment strategies and organization policies for the overall development of nursing industry and professions?
Okay, now empowerment is important, But I think we need to empower ourselves. Power doesn't come served on a platter to anybody. So I would like to give out this message to nurses that don't wait to get empowered. Empower yourself. And the first way of empowering yourself is remaining up to date, communicating, sharing information, communicating with not only with nurses, but communicating with other healthcare providers, becoming up to date about global best practices and trying to incorporate that. These are some of the things which hospital organizers, administrators, nurse leaderships have to encourage among the very young nurses, because junior staffs and young nurses come up with new creative ideas, and these should be encouraged to be shared and adapted if possible into the system. So first thing is, please empower yourself, remain up to date, have knowledge, advance your career by pursuing higher degrees. Higher degrees does not mean that you have to get only doctorate, but you can do short-term courses. You can do specialty courses. There are plenty of courses available today, and the scope is huge, what we never had earlier days, but today their scope is huge. So that is one thing. For the organizational structure to empower nurses, I would mention that what we have in many of the good corporate and private sectors, and even wherever I have worked over the past years as administrator, we have tried to create new clinical positions, so that nobody feels stagnated. Once you specialize, say we had the cardiovascular thoracic specialization course. Once you specialize, you work as a clinical specialist. You get the title, and then you are given an extra role or a team leader or something which in the organizational structure, in small steps, not that you jump up to the top post immediately, but take small steps and build up their career step by step. So if they come up this way, by the time they reach the top level, which doesn't take very long, by the time they reach the top level, they are well prepared and automatically they are empowered because they've taken up these roles alongside. So that is one thing very important. And so this is within the organizational structure. And these initiatives, again, nurse leaders should not wait that someone is going to give the position to them. Nurse leaders have to read up what's happening all over the world, and they have to come up with suggestions that why this kind of a position. Say, for example, in an oncology hospital, cancer hospital, an enterostomal therapist is very helpful. So the nurse leadership has to come up with that role, invest in the nurse, send her to get the specialized training, come back and help her to establish a small clinic where she will function as an enterostomal therapist and get the management to support this. So this is how empowerment will occur. So I mean, the whole thing has to come from us. It is not that someone is going to come and give you the empowerment. It's not a package tied with a red ribbon. So it is something which we have to work up for. We have to think of ways and means how we can empower ourselves and our nurses.
So coming to the next question, ma'am, we have many young aspirants are willing to join the nursing field, but then they are unsure of how to proceed with the same. So how would you like to guide them with this?
Okay, the young aspirants, I would like to say that first of all, do your homework, find out what nursing is really all about. Because many people come into nursing looking at the end result, the lucrative jobs overseas, and higher positions straight away, but it doesn't happen automatically. You have to go through 4 years of grinding hardship and a lot of hard work at the bedside, and nursing is not a glamorous job. So there's a lot of sweat and toil behind patient care, and you should be mentally strong. You should be able to face trauma, death, injuries, blood. Everything is not pleasant. There are positive moments. There are moments where you really feel on the top of the world, especially when your patients recover and go. But not all of it is pleasant. So you should be mentally very strong. You must have physical stamina and a good body to be able to withstand, because physical labor is also involved. You know, you have to turn, push, pull heavy patients, and you have to be really strong. And many times you have to work long hours on your feet. So you have to be physically very strong. So these are some of the things. And I would like to say that you can shadow a nurse in any one of the hospitals after taking permission, and see, like, to do a career ground homework to find out what nursing is all about. And you must be basically people oriented. You must be caring for people. You must be having the, you know, the emotional quotient to be able to take in human factor of separation, disaster, especially mass scale disasters. Recently, the way we had the pandemic, the nurses withstood. Many left nursing, but most of them withstood it in spite of the hardship. So that kind of mental and physical stamina is needed. You must be very strong emotionally also to be able to take up nursing.
Agree, ma'am.
And
Okay,
you
going.
be a learner.
Yes, ma'am. Sorry, ma'am.
I said you have
Okay.
to be a lifelong learner.
Yes, true. I completely agree. Going forward, ma'am, how important is it to introduce digital training diffusing technology within nursing domain?
Technology has taken over a lot of nursing, especially the nurses have to do a lot of documentation. So this is an area where, at least in the corporate and private hospitals, where the in thing now is to become paperless. So usually the experiments are started with the nurses. So the nursing documentation is all going paperless, computerized, but unfortunately we don't provide them with adequate infrastructure. So if everything of the nursings have to be really technically savvy, which they are, the youngsters nowadays are digitally aware and technically savvy. All we have to do is to get them into the system of nursing documents or medication, how to prevent medication errors by using barcodes. So these are some of the safety measures used, you know, scanning barcodes for preventing patient identification errors and medication errors. And nursing documentation on the computer, if we have to do it, we need to be aware. Organizers and administrators need to be aware that you have to provide that many bedside computers for them to do. You can't have just one computer in the whole unit and expect nurses to be digitalized. It's not possible. It's not going to happen, and there will be inaccurate documentation in that case. So we are all for it, and a lot of hospitals have introduced the cow, the computer on wheels, where every cubicle has a computer, and the nurse takes the computer on the trolley, bed to bed, and does a documentation then and there. And it has worked very well, including the nursing care plan and everything. So it's working in many places, but still a lot of work has to be done on that. But the barcoding system is not universally implemented everywhere, which is one of the safest methods of preventing medication error.
Thank you so much for giving your inputs. Okay, going forward.
And also digitally, nurses have advanced because a lot of online courses are there, so they can get a lot of information. Many hospitals, they don't buy physical journals and books these days, but they provide online access. So a quick reference, the nurse can get the information handy, whatever she's looking for. So that is also there.
Sure, ma'am. So yes, thank you so much, ma'am, for sharing. So we would go forward with the with our few last questions. That is, what would be your recommendations to the leaders of the country for bringing positive changes in the nursing industry?
Leaders of the country, as in nurse leaders.
Yeah, leaders of the country, like the government. You can see as government and the leaders. Yes, the global leaders.
The government and the hospital leaders and the government leaders or the community leaders, they need to give some amount of free hand to nurse leaders. They have to give some amount of free hand, the decision making capacity, involving them in governing bodies. They have to involve nurses in the governing bodies, which is not, this happens all over the world, but unfortunately in India, Recently, of course, I think a couple of years back, the expert nursing committee was set up in Delhi alongside the Indian Nursing Council. The expert nurses committee was set up. But that's just 2 years back, it was set up, and just one body. We need in every state and perhaps in every district or in every healthcare decision making body must have a nurse member, a knowledgeable nurse member. And even the Directorate of Nursing, which we have in West Bengal from a long time, now most of the states have developed their directorates of nursing with a postgraduate qualified nurse at the helm, taking decisions for nurses. But then they also are they also report to the medical directorate. So that autonomy has to develop. That autonomy should be given to nurses, that related to nursing power, nursing positions, and nursing education, or what all the infrastructure to be provided for the nurses. Their nurses must have a free hand to take decisions and speak out what is needed. Infrastructure for nurses' living conditions, wherever they provide, especially in government hospitals, where they provide hostels, and these living conditions, even in private sector, need to improve. They have to give a good lifestyle and basic respect. What is our theme this year? Respect and dignity to the nurses. Not only investing, but give respect and dignity. So if your basic life living conditions are not respectful and dignified, then it doesn't make sense. So these kinds of things also have to be looked into. And even when one builds a hospital, a central government hospital or a government hospital or a private hospital, there has to be a knowledgeable nurse at the crucial core committee. Because once the hospital is built and then you put the nurses into work there, we find that the hand washing facility is not adequate. We find that some bed space is not adequate. We find that some machine does not fit into that area. It's too late at that time. So right at the beginning of planning, whether central governments, state government, or private sector hospitals, they must involve a nurse. And nurses, we have to sit up and become aware. We must be aware of what is the basic requirement of structurally constructing a multi-speciality hospital. Then only we will be able to contribute and speak up. So we need to do our homework and be absolutely aware.
Thank you so much, ma'am. I think you've spoken completely the crucial points which is required. So coming to the final questions, what would be your key message for the audience across the globe with respect to nursing industry and profession?
As I say again and again, my only message is respect cannot be demanded. We have to command respect. And in order to command respect, we need to live our lives in a dignified manner. We need to update ourselves, be knowledgeable, be articulate, understand what are our weaknesses, and work on those weaknesses. We cannot remain in a status quo saying that this is it. We need to completely develop ourselves as an ongoing method, because the world is changing. Healthcare scenario is one of the most rapidly changing things. Like the digital, digitalization of healthcare has suddenly boomed into the healthcare system.
Thank you so much, ma'am. Once again, ma'am, I would like to say thank you wholeheartedly for giving such valuable inputs about nursing professionals and industries. I hope after going through this video and understanding the present scenario, we as an individual understand that there is no health without healthy workforce. High time that the world starts respecting the credibility of nursing professionals and pay equal respect to the profession which it deserves. I would request everyone out there to raise awareness, support our healthcare workers for the betterment of complete healthcare ecosystem. So thank you, ma'am. Thank you so much for joining us.
Thank you so much. Thank you.